Right now, try this, but only if you feel steady and have a sturdy chair or counter within easy reach. Otherwise, stay seated and simply follow along. Stand tall, lift one foot just a few inches off the floor, and hold it there. 10 seconds. That's all. Did your arms immediately move outward? Did your body begin to sway? Or did you instinctively reach for support? That reaction does not diagnose a balance problem, but it may offer an important clue about something many people rarely think to check. This is not a fitness trick. Standing on one leg is commonly used by physical therapists as one part of a broader balance assessment because it challenges several systems at once, including vision, the inner ear, muscle control, and the body's awareness of its position. In the next few minutes, we'll explain what this simple test may show, why balance can gradually change after 60, and which signs may deserve closer attention. When they work together efficiently, standing on one leg can feel almost effortless. If calm, practical explanations like this help you better understand your health after 60. Subscribe to Silent Health Triggers. Now, let's look at what can gradually make this coordination less reliable over time. To keep you upright, your brain constantly combines information from three main sources. Your eyes track the space around you. Your inner ear senses movement, direction, and tilt. And sensory receptors in your muscles, joints, and feet detect pressure, body position, and even the smallest shifts in your weight. Together, these systems make tiny, automatic corrections, often before you even notice that your body has started to sway. Several everyday factors can influence this coordination, sometimes without you noticing. Spending long periods sitting may mean less daily movement for the muscles and joints that help control posture, especially around the ankles and hips. Shoes that are worn, loose, or have poor traction can also make steady footing more difficult. And when you stand up too quickly, your blood pressure may briefly drop, causing lightheadedness or a moment of unsteadiness before your body adjusts. A single wobble does not prove that something is wrong. Balance naturally varies from one moment to another, but repeated dizziness, frequent near falls, or a sudden change in your stability should not simply be ignored. The important point is that balance is shaped by many small daily factors, and some of them may be possible to improve. Occasionally wobbling during a balance check is common and does not automatically mean that something is wrong. But certain patterns are worth discussing with a healthcare professional. Balance that has been gradually getting worse, frequent or unexplained dizziness, numbness or reduced sensation in the feet, or repeated falls and near falls. A sudden change is different. If you experience sudden, severe dizziness or loss of balance together with chest pain, confusion, difficulty speaking, new weakness or numbness on one side, or a sudden change in vision, stop the test and call emergency services immediately. Balance is influenced by more than muscle strength alone. Certain medications can affect coordination, alertness, vision, or blood pressure. But never stop, skip, or change a medication without first speaking with your doctor or pharmacist. Poor sleep can also reduce alertness and slow the reactions your body uses to correct a sudden shift. And dim lighting at home, especially in hallways, near stairs, and on the way to the bathroom at night, can make obstacles and changes in the floor much harder to see. The good news is that some of these risks can be identified and adjusted without changing your entire routine. The encouraging part is that a few small, consistent habits can support better balance and reduce avoidable risks. If you feel steady enough to practice, try brief balance exercises with a sturdy counter within easy reach. The goal is not to force yourself to hold the position longer. It is to give your balance system safe, regular practice. Wear well-fitted shoes with good traction especially when walking outside or on smooth floors. Use night lights in hallways, near stairs, and along the path to the bathroom, so changes in the floor are easier to see. And after getting up from a bed or chair, stand still for a moment before taking your first step. This gives your body time to adjust. Stop if you feel dizzy, faint, or unusually unsteady. None of these steps is dramatic. That is precisely what can make them easier to repeat and maintain. But improving balance is not simply about exercising more. Fear of falling can sometimes cause people to restrict their movement or avoid everyday activities altogether. Over time, that reduced activity may gradually affect strength, mobility, and confidence, the very things that help you remain steady and independent. The goal is not to move less. It is to keep moving safely and consistently, using a sturdy support when needed, and choosing activities that match your current ability. And if fear or unsteadiness is keeping you from normal daily activities, a healthcare professional or physical therapist can help you find a safer way forward. So, could you stand on one leg for 10 seconds? Whatever happened, remember, this simple check is not a diagnosis, a score, or a verdict on your future. It is only one observation of how your balance responded at that particular moment. Balance can vary from day to day, but regular movement, safe practice, supportive footwear, good lighting, and attention to sudden changes can all help you protect your stability and confidence. This video is for educational purposes only and does not replace medical advice, diagnosis, or treatment. If you are concerned about your balance, have experienced a fall, or notice a new change in your stability, speak with a qualified healthcare professional. If this video helped you understand your balance differently, subscribe to Silent Health Triggers for more calm, practical guidance on staying strong and independent after 60. What is one small change you could make today to feel safer and steadier at home? Share it in the comments.